Thanks. It's called Settle Down, The Link, The Breeze, 93.9, 917. Let's go ahead and bring up on the K-Wave News Zoom room. We'll do a little side-by-side here. Hopefully you guys won't run into either of these gentlemen over the three-day weekend. We have Sergeant Paul Tapau of the Guam Police Department, Major Anton Uggan of the Department of Corrections, the 1-2 punch of law enforcement here. Sergeant Tapau, good morning.
Hey, Fide, good morning, Chris and Sabrina, Jason, and all the staff at KUM. Morning, Major. How you doing, sir?
Good morning, Major. We have Major Anton Uggan of the Department of Corrections. You got to unmute yourself, Major.
Okay, doing good. I'm doing good. Good morning.
Right on. Got to give it up for Major because he's, actually zooming with us from the parking lot at DOC, and it looks like it's hot today. Major, we'll just start with you. I guess, first of all, congratulations. We didn't know because I was so distracted by Senator Amanda Shelton. So she did this Mangafa bill, and it had like 50 million typos in it, and they actually had to do a whole session just so she could red pen her bill, which she didn't even need to do because the governor could have just given away the money. But with all that happening, I didn't even know that they confirmed the DOC director.
Congratulations.
Thank you. Yeah, he is confirmed. The director has been officially confirmed by the legislature.
What's his confirmation name?
Well, we're now calling him director instead of acting director. His official title now is Director of Corrections.
Right on. And so, Major, you guys have had, it's been musical directors over there at the prison. How key is this just from, you're a classified employee, just speaking for the staff to finally have someone in there who, from what it looks like, is going to be there for a little bit?
Well, it brings stability to the organization, knowing that the director is now confirmed and he's going to be around for a little bit longer. When you're acting, you just don't know what's going to happen, right? So, again, it's just reassuring now to have him in the position for real.
Let's move on into testing, Mayor. I mean, not Mayor. Oh my goodness, Major Uggan. Any word yet on the continuation of testing at DSC?
Yes. In fact, we are. Public Health will be visiting our facility today for another site visit. We're looking at testing the Agana detention facility, all the detainees down in Agana, possibly by next week, early next week.
Mm-hmm. How many detainees do you guys have? Well, it's going to change probably next week, right? Because you don't know how many people might get arrested over the weekend.
Yeah, the population fluctuates, but usually it'll be around 120 to 130.
Mm-hmm. How many detainees are you
Plus,
guys?
I believe we're going to also test some of the. We have about 120 down there, I think, as of today.
Mm-hmm. What's the max you guys can take in?
Well, we've taken as much as 175, but today we're down in the 120 mark. So we try to keep it around 120 to 130, manageable level.
Okay, so next week we're looking at testing the detainees. Anybody else? Staff?
There may be some staff also that are down there that we will test again. It's been several weeks since we've tested the staff, so I believe some of them down there are going to get retested. Mm-hmm. And just do a clean slate, do everything fresh.
But since the last time we spoke, anybody tested positive or anybody came down with symptoms, inmate or staff-wise, or detainees?
As far as inmate and detainees, no. Nobody is showing any symptoms. However, we have had a staff member recently test positive. He's been out of work for a week or so prior to testing positive. What it was one of his family members that tested positive. So our management told him to stay home, not to come to work, and go ahead and self quarantine. And he eventually developed some symptoms 4 or 5 days later, and then he tested positive too. So, but he's been away from our facility for maybe more than almost since the 24th. I guess he's been away from our facility. So we're not we don't believe that he could have infected any of our staff or inmates because he was already away from the facility
Okay.
prior to him testing positive.
Right. So that's the only officer. That's it.
As of recently, yes, that's the only officer that I'm aware of that has tested positive.
How about we'll move over to Sergeant Tapao. What can you tell us about just the status of GPD positives and any testing efforts that might be underway?
Okay, so to date, we do have 11 confirmed GPD personnel that have actually tested positive with the COVID-19. Now, I believe one of our positive employees is actually recovering and returned back to work. So that's a good thing. We still continue to monitor any clusters that may develop. As you know, last week we reported heavily with our specialized units and everything, with our personnel. Now, moving forward, we were able to adjust accordingly with personnel needs and fulfilling the mission of each respective division or section that was affected with, the absence of some of the personnel. So, nonetheless, we still work in accordance with the mission that's asked of each division, and of course the GPD personnel, whether it be our uniform or civilian support employees. We continue to support our officers and employees who are home and in isolation and in good spirits. We're hearing good things that they're doing well. So that's a good thing. God bless that they remain positive and continue to support them. But we continue to monitor where the areas where we feel where it may be a cluster. And fortunately, since last week or our last report of our last positive, nothing has manifested as of any of the close contact that was identified to the last positive test that was released or that was identified last week. So we're holding ground, and again, the mission still remains the same. We still got to continue to fulfill the mission with the Guam Police Department.
Right, Sarge. We had public health on earlier this morning, and we're talking about these COVID inspections that they do. And there was a church, I think it was Calvary, one of them in Aston, right, where I guess the environmental health, public health inspectors showed up, and they cited them for not enforcing the mask. They were saying nobody's wearing a mask, no social distancing. How is the Guam Police Department involved in responding to calls like those? Because the public health people had said that, we can go in and, we can cite them, but, environmental health can't necessarily shut down a church. So, again, we're back to that enforcement question. So when the environmental health guys go out on these calls, are they accompanied by the Guam Police Department? And what's the process?
Should the need arise, we do have a task force, 24/7 task force that has been developed. We do have a task force that's assigned to the beaches and the parks. Last week, the governor had allowed the recreational use and wellness of the parks and everything. So we're seeing 100% compliant. We have a task force that's available for that. We work closely with the Guam Visitors Bureau, VSOs, in ensuring that people adhere to that. And, like I said, it's 100% compliant since the governor allowed or lifted the restriction. Now, with our other task force, we do have a response team that will assist for any COVID operations. And we work closely with the Department of Public Health and Social Service in ensuring that these mandates are enforced. They are the regulatory agency that will issue the citation. And, we provide the support should it arise. And, being a 24/7 operation attached to the assisting agencies, or we are the assisting agencies for the Department of Public Health and Social Service. They'll issue the citation, and we'll work with them in gaining full compliance from those that violate either the public nuisance memo or the the just pretty much any of the executive orders. So we work closely with them. It's beautiful how we were able to, allow the personnel to focus on the beaches and the parks, and also allow and adjust accordingly to assist public health. And as you saw, when they did that trial run with the funeral services to the quarantine, or the individuals that were in quarantine, to allow them to attend, there was police presence to assure again that they comply with the social distancing, and of course anything associated with the executive order, and maintaining overall health and security within the community.
Okay. So did they get a ticket?
I believe they were cited. The Calvary Baptists were cited, and again, it's going to fall on them, because it just doesn't end there, because now you have the right to operate, and that falls under the I believe WAM revenue and taxation that can actually pull you and work at defunding or defuncting your occupational permit. So this is something that can gravitate into something more. They'll issue the citation. We're alongside that, nothing escalates beyond that, and we're there to assure that there's compliance with what's going on with the issuance of the citation for any violation.
Major Anton Uggan, let's if we could touch briefly, and then I'll flip it back to you, Sergeant Tapao, because we're still seeing these drug busts. People getting pulled over, obviously not staying home, but behind bars. Major, are we still seeing? Because we've talked to you, all throughout this. Are people still chucking meth and chewing tobacco and whatever else over the fence at the prison? Yeah, right. Unmute, Major.
Yes, we still have a few incidents of contraband being thrown over our perimeter and attempted to being smuggled into our facility.
Are they getting restless though? I mean, they got no visitors, no incoming. Do you see them? They're getting a little more frustrated these days. And are you guys concerned the longer this continues that it might reach a boiling point?
Yes, they're getting frustrated. We've had to stop a lot of activities, even including recreation. They don't even get recreation at this point. No visitation, no incoming, like you said. And, there is some frustration amongst the inmates, but the management is, constant communication with them. And I guess for the most part, so far, most of them understand why we're doing it. Doesn't mean they're happy with it, but they understand what's going on and why.
Right. But you guys have plans in place, right? In the event this drags on and they get more frustrated, you guys do have something in place to address this potential, right?
I mean, we got plans to start. Yes, we got plans to start allowing them to do recreation. Again, if we go back to PCOR 3, we will be allowing incoming, like we did last time. But other than that, there's really not much else we can do until we go back to PCOR 4 as far as visitation goes.
Are we worried at all, Major, about because obviously inhumane conditions at the prison, it's a recurring theme. By not allowing the inmates and detainees to receive things from their family, are we worried that could be construed as inhumane? I mean, I know we're in a pandemic, but don't you think that by now you guys should have come up with some type of process? I mean, God, Major, it's been months.
About 5-6 months.
Yeah. And so when you talk about the inmates and detainees getting restless, I'm pretty sure that's part of the equation.
Well, so we are providing, the government, DOC is providing cleaning supplies and all the hygiene products that they need. We provide it. That's our responsibility, and we do provide it. We do have limited amounts, so not everybody gets what they want compared to when individual families were dropping off for their loved ones. The cleaning supplies are, distributed on a weekly basis. Inmates are given masks. And the other thing too, Chris, about allowing families out there, the governor has ordered people to stay home. I've got family members that tell me, hey, thank you for not allowing us to bring incoming, because they really don't want to run around the island looking for cleaning supplies so they can give it to their loved one in here. So you want to minimize even the families from having to go out and shop for these items if they don't need to. Some would like to drop it off, others, prefer not to. And so that's just the situation we have to deal with for now.
Yeah, but I mean, we haven't been in PCOR.
You're gonna,
We haven't been in PCOR 1 this whole time, though. So have we reinstituted at any point the incoming during the PCOR 3 and PCOR 2 declarations? I know that you guys had
Yes,
a thing where you're like bringing the boxes and then you cut that because of the risk.
Chris, we did have incoming during PCOR 3. Okay. We had a drop-off system. We also had it where postal packages were coming in. Family members were sending parcel packages in with cleaning supplies. I mean, at one point we received over 87 packages. So we were allowing those things to come in. It's only when the governor went to PCOR 1 that we went back to restricting everything.
Any more cell phones?
And again, once...
Any more cell phones found inside?
I believe we found one or two. Yes, I believe we found one or two last week.
Wow. So we still don't know where these cell phones are coming from? We don't know where these cell phones are coming from?
No, the phones are being found in common areas, and we get them and we turn them over to GPD. We don't have the capability of tracing the phone calls or even opening up the phones and doing any kind of searching on any of those items. We confiscate it and we turn it over to GPD. If it's found on a person, then we get them they get charged criminally. If it's found in common areas, we just confiscate it and again turn it over to the Guam Police Department's property evidence and property section.
Let's go back over to Sergeant Tapao. Sarge, we get the Maggies, we see, but just from your perspective, what types of crimes are people getting arrested out there for when we should all be staying home?
Man, keeping up with the Maggie reports and my police media release, I found that it's really hard to keep up when we're seeing a lot of drug abuse, and our officers are really hitting it hard with the drug interdiction. And I think it's time we're being that it's ironic that we're in September, and September is Substance Abuse Awareness Month to include Suicide Awareness Month, and you guys were able to talk about suicide yesterday on your show, which I thought was really beautiful because we're seeing that too as a reporting agency with the Guam Police Department, an uptick with aligning ourselves with Guam behavior. But Major Anton can attest to that the number one intake that they're seeing a lot of is really substance abuse, and primarily the still the prevalent choice of our fellow Guamanians is the crystal methamphetamine, and we're pretty much seeing that on a daily basis, and it's really our officers through their drug interdiction and of course traffic stops that lead and to the discovery of crystal methamphetamine. It's really, you can go a night, you can go through a day, and I guarantee you'll have at least 6 individuals that either were arrested, either from the northern end to the southern end of the island with possession of crystal methamphetamine. So, we're seeing a rise in that, and whether it be for common, personal use or somebody with in the intent to distribute because they have a substantial amount. It speaks volumes that it's still there, it's still prevalent amongst our fellow Guamanians who are suffering through addiction. So this is something where we are tracking, and we want to street interdiction versus working alongside with the feds. They did seized, I think, 3 pounds of meth, I think, last week.
Yeah.
It's a significant amount. So, it's here. So understanding what we need to do as a community, and, there's a lot of factors associated with drug addiction, and, Teresa Ariola at Guam Behavior, her team has they've been working really hard, and addressing suicide and of course addressing addiction. And I think Major can chime in about our guys inundating the intake with people who are found in possession. And it's just this is something as a whole, as a community, that we need to understand that we're still fighting this battle with drugs. Crime is still being committed amid the pandemic, but again, we still continue to carry out the mission.
Yeah, it's scary, Paul. You just make it sound even so much more scary hearing that, considering the fact we're dealing with an economic crisis, a pandemic, a healthcare crisis over GMH, a mental health crisis with so many suicides being reported, and we're still dealing, like you said, this drug epidemic.
Yeah.
And so we asked people this week, are we going to be okay for GPD, DOC, law enforcement side, and the responsibilities that you guys have to handle? Are we going to be okay?
We are. It's tough. There's a lot of challenges. From one agency to the other agency. My brother Kevin was on your show yesterday, and just to hear that the frontliners are aside from the things that we have to do, whether it be taking care of a correctional facility, patrolling the streets and assuring safety, or just responding to a sick person. You never know, dealing with COVID. But aside from that, our primary mission is to safeguard the community, regardless of where we are in different agencies that provide safety and security. But the challenges are there, and our guys continue to carry out the mission. And it behooves me if I don't mention that our guys understand what needs to be done. And we continue to work, and we're working at recruiting more officers. We continue to work closely in adjusting accordingly to fill the gaps that, whether it be retirement or whether it be to resignation.
That sounded like I don't know, but Lord help us.
We're
That's what that
good.
sounded.
We continue to work, and prayers are always good.
I'm praying.
I got the mask on.
We pray for everybody. We work closely with the community abroad, and it's just unfortunate that we still have to face our social ills with crime, and of course dealing with the pandemic. And when you have the two dealings, working with that, it becomes overwhelming at points. But we have coping mechanism. We're working closely with our peer mentorship program. We're working closely with Guam Behavior to assure that the well-being of our officers, or our overall GPD personnel is addressed and catered to. So Chief Ignacio was really adamant about pushing out our peer mentorship program. So we have that's available for our personnel within the ranks, and of course to address the needs of our civilian support employees with the Guam Police Department. So understanding what we need to do, this is where we all need to work together as an island and approach this from a holistic standpoint.
Right on. Major Anton, closing statements.
I think he froze.
I don't know how he froze out there in the hot sun. Right. Okay, Major, closing statement.
Well, I mean, again, DOC is still doing all that it can to ensure the safety of the inmates and the staff, and we will continue to do that.
I can see the screen.
Hopefully, we'll get out of this COVID situation soon, but we just got to do what we have to do in the meantime.
Thank
Stay
you.
safe, guys.
Yeah, be safe, guys.
Stay safe.
Wash your hands.
Might be a busy
Enjoy
weekend.
your weekend.
Yeah.
Three-day weekend. Please, adhere to the, refrain
Stay
from any
home.
social gathering.
Oh, God.
It's
Stay
gonna
home! Can you just put me on the siren of GPD? I want to be the, when you guys turn on the siren, like, stay home, just like, instead of,
instead of
You
the
know, you should reach out to Charles Esteves and
Yeah.
the tag and ask if we can.
Well,
have
that's
the
even better.
recording
That's good. You're right. Good
and
idea.
sirens,
Sir.
So, you
Thank
know,
you, Sarge.
You'll be the
all
early warning.
seriousness,
Don't
you
encourage.
know,
it.
it's a 3-day weekend. Let's understand what needs to be done. And you know, I heard the DPHS personnel talking about staying home and everything, and
Yeah.
they kept it